Hello, welcome to our presentation. We did ours on virtual reality for mental health. So, first, we want to talk about the benefits for virtual reality within a professional sense. So, virtual reality provides a real world environment for assessment and intervention, enhancing ecological validity. And it also allows for personalization of the VR experience to match the individual's needs, abilities, and preferences. And for the population, VR can provide a safe environment for users to face difficult situations. It can also be easily generalizable into a real life context. It increases their motivation to engage in treatment and assessment, and it also promotes physical activity to decrease any symptoms of mental health disorders.
So, when looking at the disorders specific to mental health that VR can be used with, this is something that could be useful for individuals diagnosed with things like anxiety, depression, OCD, addiction, schizophrenia, phobia, eating disorders, and PTSD. And we'll kind of get into more of the details about some of those when we get into the games. So the games that we chose for our mental health population are Fit XR, Fruit Ninja, and Meditation Island.
So, application of the games. So, the apps we focus on are on different aspects of mental health, along with other components of the app that can be used in like a variety of contexts and symptoms. These apps can simulate real life in real world environment in a controlled area that is safe for the individual and allows the person to manage their mental health system, um, to help with their mental health symptoms in a private space so that others aren't around them and if they feel uncomfortable with others near them. The games provide components of coping skills with a variety of breathing, meditation, and relaxation. They also involve area for movement and seeking or managing their fears in public. So the first one that we chose is called Fit XR. There's a little video if you want to watch it. You can look it up right in YouTube. Just kind of shows you what to do. So this app is all about going in, picking your different fitness activities, and then it plays it.
So the first game that I looked at was called Fit XR. And the purpose of Fit XR is to engage in a fitness program of your choice, where you follow the instructions from a trainer on how to move your body and match what they are verbalizing or demonstrating. It's really important because exercise has been proven to decrease stress, anxiety, and depression, while simultaneously increasing both psychological and physiological functioning. And there are several class trainer options available on FitXR, including boxing and combat, which is a martial art and boxing inspired workouts which are catered towards emotional regulation and proprioceptive input. There's dance and Zumba, which are full body workouts set to your favorite songs to increase mood and regulation. There's HIIT training, which stands for high intensity training, and which is fast paced, full body focused on agility, endurance, and reaction time. And then there's Sculpt, which is a low body, low impact, high burn workout inspired by barre and Pilates for mindfulness, breathing, and body awareness. So we chose to do an activity analysis for Fit XR. We started with the equipment setup, which includes pressing the power buttons, donning the headset, securing the controllers to your hand, and syncing the controllers to the headset. The second step is the game and workout selection, where you can navigate the game library, locate Fit XR, and press appropriate buttons using the controller to choose your desired workout type. And then during the actual gameplay, you will follow the instructor's guidance, including actions such as punching, ducking, dodging, or dancing in the rhythm, which will coordinate the upper and lower extremity. And then to end the gameplay, you would press finish game, review your results, remove the headset, power down equipment, and reflect on your experience. The skills addressed with FitXR include attention, frustration tolerance, memory, problem solving, sequencing, decision making, self-esteem and confidence, motivation, and emotional regulation.
All right, so the next game that we played was Fruit Ninja, and we're going to play a quick video just to give you guys an idea of kind of what this game looks like and how it's played. Unfortunately, the video is not working, so if you'd like to view what Fruit Ninja is like, you can press the link in the post to get a better understanding of this game. So Fruit Ninja offers multiple game modes, of which we focus on the classic and Zen mode, which are two different types of mode within the game. The purpose of the game is to use quick movements in a variety of directions to slice as many fruits as possible without hitting the bombs. So within the classic mode, it offers the client an ability to increase their movement if they are movement seekers, and this can also be applied to multiple different ages. And within the Zen mode, it follows the same principles as the classic one, but it does not have a time limit, so less stress on the individual, and allows them to focus more on actually slicing the fruit, taking their time, and having them paying attention to the task. It also provides calming music, and that can also be an environmental factor that can prevent stress and anxiety, which would also be good for this population. And we did find that Fruit Ninja can promote stress relief, relaxation, mindfulness. It can boost the individual's mood, provide positive reinforcement whenever they accomplish the game, and also encourage fun, interactive play.
So looking at the activity analysis for Fruit Ninja, we have the equipment setup, which similar to the last one, you have to press the power buttons, don the headset, secure the controllers, and then also sync the controllers to the headset. And then it comes to game selection, where you can navigate the library, locate Fruit Ninja, and press the appropriate buttons using the controller. And then looking at the gameplay, selecting your game mode, like we talked about in the last slide, there's Zen or Classic for this game specifically. And then playing the actual game, slicing the virtual fruit using coordinated upper extremity movements and avoiding virtual bombs. And then to end the gameplay, you remove the headset, power down the equipment, and reflect on the experiences. So some of the skills that this can address is attention, memory, problem solving, sequencing, frustration, tolerance, self-esteem, motivation, and orientation. Looking at our next game, we played Meditation Island. This was a super, super fun and interesting game. We have a little video here of Rachel playing. These are cute stickers, Katie.
Help yourself. It's for you guys. Happy Oaks.
So essentially what this game does is provide a calm space for meditation practices. It also provides a distraction technique to reduce pain, stress, or anxiety. It can provide positive sensory stimulation for relaxation effects and increase mind-body awareness. Provide positive affirmations to increase self-esteem and confidence. So like, for example, when you're in the game, you have like a headset on and the speaker says different positive affirmations to you. So one thing that she said was, you deserve to take time for yourself. And so there's just different examples like that within the game mode that you choose.
So for the environment regarding Meditation Island, we chose the beach mode. So to set up, you have to set up the boundaries. So with each TV Vibe, it requires set up boundaries prior to use, operated through STEM software. Setup boundaries can be completed by either the therapist or the client to grade the task appropriately. So it's just taking, since there's a cord attached to it, it's just kind of going around in a circle, square-ish format to create the length of the headset. The VR environment selection is users must select the game and select a meaningful activity. So we want them to have ability to search and have their attention to pick what they want and feel is most meaningful to them and what makes them feel happy. So the experience in the gameplay, users can use VR environment to experience with decreased stress, relaxation, and helps with anxiety, depression, PTSD, or sensory hypersensitivity. Mindfulness promotes prompts and positive affirmations are key to this experience. Any of the tasks, users or the therapist can terminate the game through the touch controllers on the headset or on the system itself. Skills addressed, we have perception, search, and attention, sequencing, selective attention, declaration, knowledge, representation, executive functioning, and spatial awareness. So the environment modifications that Ken and we made for this game, the first one, sensory. So we dim the light, limit visual distractions, adjust the volume of the game so that the person wearing it can hear it, and also the therapist can hear, if they're close by, can hear what's going on. We want calm background with calming music. The physical modifications that can be made
is providing a chair, removing any obstacles, especially because they're going to be moving around, have a wide space that allows adequate movement. We don't want anything to get in their way, especially because they have the headset on and can't really see their surroundings. So we want to make sure it's safe for everyone. A calming area that allows breaks when overstimulated, anxious, etc. from the gameplay. The task modifications, so you want to increase or decrease gameplay duration, checklists or task cards nearby to assist with setup, and then integrate any coping strategies that are needed either during or after the playing of the game.
So there are some barriers and limitations to VR, including internal and external barriers. Some internal barriers include motivation, which can impact the benefits that the VR can bring to a client, especially if they don't find the VR to be meaningful. There are some physical limitations, especially if there's limitations in the upper extremity or lower extremity, which can impact certain games and individual play, such as Fit XR. There's also external barriers, including setup and learnability, as setup requires multiple steps and could impact the client's ability to use the device. Additionally, navigating the device and playing games can be difficult to understand and may require additional training. Another downfall is that therapist experience and training is required to operate the VR systems, which may also impair learnability. And then the cost. VR systems can be expensive to purchase and maintain. So there are some precautions when using VR. VR should not be used in the following situations. Anyone that has an anxiety disorder, as certain games could heighten the symptoms and should not be anticipated and planned for. To ensure safety, as VR is often used as exposure therapy, meaning exposing clients to new situations that they haven't encountered before, as well as PTSD, which situations in which the VR is too dissimilar from a traumatic event experienced by the client. Some people may not find this meaningful. It may not actually gain any therapeutic measures from it, just because their experience is unlike what actually happened to them. And then active psychosis. There are limited studies that have been performed with those in active psychosis, so the implications are unknown. As well as individuals with multiple mental health comorbidities should not utilize VR. And also those who have a limited awareness of online social safety should not use VR.
Some risk factors that we identified that could occur within the VR experience are listed here. Being within the VR experience could cause increased frustration, nausea, ocular problems, especially if you already have some deficits with that. It can impact your vestibular inputs. It can overstimulate you. It could also increase symptoms of schizophrenia and increase anxiety within the game. So before our clients enter the VR experience, we want to provide a battery of assessments to make sure that we are assessing every aspect of the individual to make sure that they are the right fit for this VR as an intervention. So of course, we're going to do the AOTA occupational profile, and within this experience, we're going to make sure we assess their client factors, their performance patterns, and performance skills to get a good overview on who they are as a client. Additionally, we're going to conduct the coping inventory to problems experienced scale. And this is just to obtain a baseline for their current coping behaviors, and we'll use it again to reevaluate to see if their coping behaviors have changed. Additionally, we'll just briefly assess their range of motion to make sure they have adequate joint range of motion for the VR games. We will also use the MoCA just to get a good understanding of their cognitive abilities. And finally, we're going to do a sensory profile to see if their mental illnesses have impaired their sensory processing abilities. And yeah, that's what we are going to assess before the game.
So when looking at how we wanted to use this as an intervention with our mental health patient, we're looking at the Meditation Island game. So we want to use it as a preparatory method for emotional regulation, where they can spend 10 minutes in Fruit Ninja and then do a zone of regulation activity to reflect on their feelings regarding that experience. And then that would look like spending 5 minutes in the guided meditation and 5 minutes in the journaling to reflect on the activity and the coping mechanisms. And when it comes to using VR as an intervention, all of the primary domains are impacted, especially looking at our mental health clients specifically. Looking at the evidence for VR, previous studies have indicated that VR has helped improve cognitive functioning for those with mental health disorders, including schizophrenia and affective disorders, as well as there were specific improvements in visual motor skills, processing speed, and memory shifting. And then lastly, specifically, this systematic review indicated that a full immersion had led to increase in lower extremity and upper extremity strength. And that is all we have, and here's our reference slide.